Welcome to the Master Your Breath podcast. Today I have Monika Ivanović as a guest. She's a speech therapist and she will explain in a moment what exactly that means and who she's working with. And she also did a teacher training here at Zagreb Yoga School, and so we know each other. And the last time we had a coffee together, we just noticed how much of your topic as a speech therapist and my topic as a breathing coach, breathing teacher, yoga teacher are overlapping, and that there are many things that we can talk about, discuss, go deeper, and hopefully help you to find some insights into, if you have any of the issues that we will talk about, improve your situation and with habits or actually with therapy. So welcome.
Thank you for introducing me really nicely. Especially, I have one little correction. It's no more Pusilović, it's Ivanović.
Oh, sorry, yeah, true.
No, it's okay. Don't worry. I still go by both.
Okay, good.
So yeah, I'm actually a speech and language therapist, and I studied here in Croatia, in Zagreb. I finished my school a long time ago, and after around 6-year mark of my work, I started to notice that there's a lot of problems with oral motor part of my work, let's say like that, with children. Mm-hmm. And I started to notice a lot of different like wrong breathing patterns and stuff like that we have in common. And I actually switched my interest from the classic speech language therapy to myofunctional therapy. Mm-hmm. And it's really a narrow point of view inside of speech language therapy, and it's not something new, but it's new to Croatia. There's really small part of us that do this part of speech language therapy, myofunctional therapy. Mm-hmm. And yeah, that's something that is actually can be done from birth up until adult age. Mm-hmm. And with adults that I also do. So with babies, I work with really small babies that have feeding issues, that have breathing issues, that have wrong oral resting posture. We're going to get to that afterwards. With young kids, the preschoolers, school age, and also with adults. With adults it's much more complicated, but we'll get to that.
Okay, so maybe because you just said, so there's the normal field of speech therapy, and then there's your smaller field or your niche of myofunctional therapy. So maybe distinguish that for...
Okay, so let's say the classical speech therapy is something, speech and language therapy, is actually something that I consider like working with kids that are on autism spectrum. The children that have like language issues, children that have are stuttering or are really quick to their speech, and stuff like that. And then you have on the other side something, let's say a bigger name for that's orofacial myofunctional disorder. Okay, that's the name.
Okay.
And what that is actually that means that something in your face muscles, in your head muscles, is not doing the right thing, and it keeps you from eventually talking nicely. Mm-hmm. So the goal is always to correct speech, but we have so much other things that we have to work before we get to the talking part in therapy.
Okay, so as an ignorant person that just listens to that, if I, like here in Croatia, I know a lot of kids, and I would actually need that myself, cannot roll the R as it's supposed to happen. I have this German R, so I guess I'm lost with that. I guess I would have to practice a lot. And when a speech therapist helps me, they will just introduce maybe practices to help me get to that right way of pronouncing the R. And you, compared to that, what would do what differently, or what would look at the whole thing differently?
So like traditional speech therapy, their mainly goal is to correct your hearing so you hear the R better, and you repeat a lot of words that have R inside to like make it correct. But what I do is actually I focus on the muscles, because if you don't hear it, you can hear it right, but the muscles are not doing the thing that I have to do. For example, for the, let's say, R, you have to really thin your tongue. You have to put the upper part of your tongue to the alveolar ridge, so a spot here, just underneath your teeth. And you have to put it to vibrate mode. Let's just say it like that way. And what I do, so difference between my therapy, my functional therapy, and the classical speech language therapy is that in classical speech language therapy, you're going to repeat without accessing the muscles. You're not going to teach the children or the adult person how to properly use the muscles and make them go where they should go to produce the R sound.
So in that, to stay with that example, I still would hopefully at some point learn to use my muscles the right way, but not by directly addressing it and getting exercises for my tongue, but rather by applying the R, and hopefully it will happen. Yeah,
we can go both ways. I mean, you're an adult. Let's say it's easier in a way to work with adults to correct the articulation than with the children, because you are aware of what your muscles are doing. But since you have 30 plus years of your age, you have 30 plus years of, let's say, wrong R in your speech, and we have to like move that automatism that you have, correct it, and then make it automatized in another way. So we have a correct sound.
Makes sense.
So, but with kids, it's quicker. It's much quicker, because I don't know, they came to me 4 years of age, 5, 6, and they only have 5 years of let's
pattern.
say, wrong pattern.
Yeah. Even though when you say, a thing that I say now, think now when you say wrong, I could obviously argue in my particular case, I just learned the German R.
Exactly.
I'm really good in my German R.
You don't need the R in
so it's not wrong.
No.
I'm just incapable of expressing the Croatian R or the Russian R. And, especially with yoga, I like coming from yoga, it's also like, it's not that somebody has to be able to do a handstand, but learning the handstand makes you being aware of what your muscles mobility-wise can do, strength-wise can do, in terms of expressing their strength in all directions, creating stability. And so it makes sense to learn a new feature, right? Like, okay, let me learn a backbend, let me learn a handstand. Or with breathing, let me learn how to breathe out for 20 seconds. Instead of being stuck after 3 seconds or over tensing my belly immediately. And so with speech, I would say, I would think, I mean, actually I enjoy learning Croatian, even though I'm really slow in it. But it's nice to learn something new, because you just realize, okay, there's a new way of moving the mouth, new facial muscles that have to work in slightly different ways, co-contract in different ways. And so it's actually a fun thing if we look at it as some new thing that is exciting to learn, right?
Exactly, yeah.
And even with something that is wrong, like in terms of wrong in the sense of, okay, something is not properly working, therefore I cannot express myself, or I have pain in my body. Instead of thinking, okay, let me fix that, what pattern can I change or rephrase in some way, and I will feel better, or I will be even able to learn new things. So in my therapy, I'm not concentrated at all on the speech sounds. That's something that actually comes like really spontaneously when you correct the muscle pattern. So I'm not going to do the repeating of the words with those children. I mean, the older ones, for me it's older ones, because I work mostly with babies up until first year. But when you correct their muscle pattern, when you strengthen the muscle, when you relearn the new pattern of movement, and you make the brain make it out,
like spontaneously, they don't have to think about it, the speech sounds actually correct themselves. So that's the fun part in my therapy.
Great.
Yeah.
I mean, and it's actually what you just said, the connection between how the brain just naturally then switches things. It's the same with breathing or with movement, right? Like you learn in movement, you practice a certain different way of accessing a movement, or moving the arm, or co-activating and stabilizing the joint before you maybe do a push-up or whatever. And all of a sudden, your brain works in a different way. Your whole body connects in a different way, and the pain just or the whether it's joint pain, muscle pain, just naturally disappears because there's no need for the body to create it anymore.
Exactly. Now that you mentioned the joint pain, the one part of what I work with where adults actually come to me because they have temporomandibular joint pain.
Okay.
Yeah.
So explain that a little.
Okay. So
like in
TMG. Let's just like shorten it to TMG. So temporomandibular joint is actually the only joint. Yeah, right? This one. Yeah.
Yeah.
Right behind your ear. I mean, close to your ear. And when you, as you said, maybe when you use your muscles in a wrong way, you tense them too much, because of, I don't know what reason, you have pain here. Exactly. The same way you can have pain in your neck, you can have a pain in your hip because you're using your muscles in a wrong way. And when adults come to me, I also ask questions like, do you snore? Do you clench your teeth? Do you grind your teeth? Because all of that is actually compensatory movement to what the muscles are doing wrong. So I know that you also do it with the breathing. You have to, like, your body has to be aligned to breathe properly. Same with my therapy also. I don't start with, okay, you have pain here. Let's see why the pain is there and work with the cause, not like put a band-aid on it, like put some kind of like something, udlaga, how do you say it in English? Something like a braces or something like that in your mouth so you don't grind your teeth, and then you will not have the pain here. But why the pain is there? Is it because of the wrong breathing pattern? Is it because of your tension in your muscles because, I don't know, anxiety or something like that? And everything is interconnected.
Yeah, I guess it's similar to when the first thing that I teach people, like my principle one, is joyful alignment. And what I usually say is, when we have stress in our life, when our body perceives stress, which might just be, an email or the thought of a conversation I have to have tomorrow or next week.
I have to make an appointment.
Or I have, anything I have to or I should, right? Our body creates a pattern which is appropriate for running away as quick as possible for like a minute and then going back to being relaxed.
That's our neurological system.
Our pelvic floor engages, our breathing gets faster, which would make sense if you want to run, right? To load off some CO2, some carbon dioxide, so I can run a little longer, really fast. My shoulders engage, like, closing the chest so I'm safer, getting the fists active, shortening the neck, clenching the teeth, not swallowing because that would be digestion. No rest and digest. No rest and digest. No unnecessary things like immunity when I'm running. Really focused eyes, maybe even clenching the eyes a little bit. So all of that happens automatically when we're under stress. And of course, when we do that a couple of years in a row, continuously every day, more than once, like, every 10 minutes we get an email or whatever, then we might clench our teeth. And now just stopping the teeth from destroying each other by putting something in between will not change the clenching, pattern, right? So that's your point.
Exactly. No.
Very good point. And already shows that there's so many causes. But let's maybe start, again, breaking it down to an example. So you have a kid, maybe even a baby. Obviously, they don't speak yet, so there's no speech problem.
That's why I said.
But they come to you for what reasons? Like, just give us a couple of examples.
For the most part, when the baby comes to my space with their parents, it's especially because they are having problems with breastfeeding or bottle feeding. So that is the main point why they come to me. And when I do an exam, when I do an assessment on the baby, I have to see, they don't think, they react on the way they feel. So what I have to see during the assessment is actually their natural pattern of movement, the whole body, but also the movement of their face, so the orofacial muscles. And what I do is actually I have to check their primitive reflexes, how they work, how the muscles are engaged, if they can engage their muscles. And that is actually pointing me in which direction in therapy am I going to go.
What is a typical...
Okay, for most of the part, every baby has tension. So every baby that comes to my practice for an assessment, they're all tensed because what the main function of the baby is to sleep, to poop, to breathe, and to eat. And if you cannot eat, what is going to happen? You have to engage your whole body to be able to get sufficient nutrition, and you're going to tense, and their whole body is actually working to regain milk even from the breast or from the bottle. And when we actually assess the tension in the bottle, in the body, in the body, we improve the function of the muscles in their mouth. And for the most of the part, there's also some kind of restriction in their oral muscles, for example, the tongue tie or the lip tie or the combination, stuff like that. And then we proceed in therapy depending on what's happening.
Okay.
So that's the main part. And of course, most of those babies, to circle back to what we have in common, are actually mouth breathers.
Okay. Now, what would you say? Because I imagine, nature, I always go from the conclusion of nature is great. Like, nature is always creating function in a great way. Why is that not like that with lots of babies?
Especially, so, as I said, because of some kind of oral restriction. So we have seven ties in our mouth. They can be too short, they can be too thick, they can... restrain the movement of the tongue or the lip or the cheeks. So when you have some kind of restriction inside your oral cavity, you cannot move your muscles in a proper way. So if you have a tongue tie, for example, this is your tongue, you have a tongue tie. Everybody has a tongue tie.
I cannot lift my tongue up.
They cannot lift their tongue up. They cannot do the cupping to pull everything to put the breast or the bottle inside their mouth in a proper way, and then to make the suction really strong so they can pull in the milk. And if you have some kind of restriction, of course the body is going to do everything to compensate for the lack of movement, and then you have the tension in the body, and so on and so on and so on. So it starts really early.
What would be one reason for the tongue tie for that strong tongue tie, or that the inability to engage the tongue?
We still don't know.
You still don't know.
Okay. It's morally not really nice to do exams or some kind of scientific researches. When the baby's still inside of the belly. But so we don't know why it is happening. There is some theories, but it's not for this kind of podcast. But eventually, actually, the tongue tie is already formed in 12th week of gestation. So it's not something that is here when the baby is born, but the wrong pattern of movement and the suction and the suckling and everything is actually learned inside of the womb.
Oh, really?
Yeah.
Wow.
Yeah. So when the baby is born, they actually have already 6 months of, let's say, wrong pattern of movement of their tongue.
Right, there's those pictures of this ultrasound pictures of the baby sucking the thumb, right? And
why is the thumb inside? Why is it's a compensatory movement? Right. The thumb inside the mouth, the thumb sucking is actually something that we don't want to see.
Even not in the belly?
In the belly, it can show us that maybe something is going to, let's say, get wrong. Something is not evolving properly.
I just had the opposite idea that it's like the way babies learn the sucking. So when they come out,
in a way it is. But if the thumb sucking is something that is sticking around way too long after the birth, we actually consider that a bad oral habit.
Yeah, okay, that would make sense. But like in the belly, I mean, it was a spontaneous thought, but
of course they learn in that way. So, for example, the proper suck swallow pattern is developed, and the muscles are getting stronger and stronger in the last month of gestation. So from 36th to 40th week of gestation before birth. And if the baby is born before, their suckling and sucking pattern is actually not strong enough because it's underdeveloped.
Right.
And then again, they come to me, and then we work on the muscles and so on and so on.
I mean, I even heard once that then, obviously there's a difference also between breastfeeding and bottle feeding.
Yeah, there is.
Which, maybe you can say something?
Yeah, I mean, I don't want to put some pressure on the moms who decide not to breastfeed or they don't want to or they cannot breastfeed.
No judgment.
No judgment. I have one sentence that I always say. I have like a little digression that I always say to mom. I don't care how you feed your baby.
Yeah.
I need to know how you feed your baby because that's important for my therapy.
Yeah.
Okay, that's it. But how are you going to feed your baby and make the baby grow and be happy and satisfied? I don't care.
Yeah.
But the difference between breastfeeding and bottle feeding, the breastfeeding is natural response. It's the way the stuff has to go. And the breastfeeding actually helps to strengthen the muscle, to learn the proper movement of the tongue, of the cheeks, of the lips. And it also spreads the palate.
Right. I mean, it's a little harder, right, than the bottle?
It's much harder than the bottle.
And therefore, it exercises the muscles differently.
Differently. Because with the bottle feeding, the baby can compensate. When you push the nipple of the bottle, it flows. The baby doesn't have to suck. They don't have to do like pulling motion, the vacuum so strongly as they have to do during breastfeeding. And the bottle it's fixed.
Yeah.
The breast, it's shaping depending on how the baby's mouth is. But the bottle is hard. The nipple of the bottle is hard. It doesn't change shape. Yeah. So there's always a difference in the oral motor movements with the breastfeeding and the bottle feeding.
Yeah.
And prolonged bottle feeding also makes the shape of our whole palate, the tongue, the muscles, and the whole face actually develop differently.
Right. And I think it's very important what you said, that there's no judgment, and of course anybody can do whatever they want, but there are implications of what you do. I mean, in just of course you can decide as an adult to sit in a rounded position and collapse and forward head position.
Yeah, forward head position.
And not work out at all or eat crappy food. All these decisions are yours, but they have implications. Exactly. And if you do something for 8 hours a day or 24 hours a day, every day for a couple of years, then that has implications of how well your body might function. And your body will adjust to whatever you ask from it. Yeah. And as a baby who is essentially doubling in body size in, 6 months, 1 year, and is growing so much and still has to develop all these patterns, of course, there's a difference.
Of course.
Which means, I guess, when you decide to, for example, bottle feed, you want to fill that, let's say, missing exercise for those muscles in a different way.
Exactly.
And that's where kind of you come in.
Yeah, well, that's where I step in. Yeah, that's where I step in. I mean, of course, we have long live the marketing space, but we have all of the different nipple sizes, breast bottles, nipple shapes, and everything. And a lot of them are shaped like the breast, and the management goes in that way.
Yeah.
But it's not true. So of course, I always say I have bottles that I really like and that I'm going to recommend for the parents to use. That are, let's say, better for their oral motor aspect, and then the other bottles. So what I look in a bottle is actually not that it's shaped like a breast, because no bottle can be shaped like a breast, because breast itself, it changes shape depending on, I don't know, morning and night, depending on how the baby is positioned, how the baby is lying down, you're sitting, or whatever. And some bottles are better. They're harder for babies to adapt to, because they have to use their muscles.
Okay.
But I'm going to always recommend the harder ones, because they, as you said, we have some implications on how the oral motor movements are going to adapt and how they're going to develop depending on the nipple shape.
Okay, so choice of bottle is one thing, or choice of how to feed breast versus bottle is one way. What are some other things that someone might even try out at home before they even come to you, like as something that everybody can try at home?
Okay, so more or less the first step when the mother sees that the breastfeeding is not working properly, they contact the breastfeeding specialist. So some IBCLC, some CLC, so the person who is educated for breastfeeding and how to help the mothers position the baby in the right way and the better way to help them breastfeed eventually. So more or less mothers go to the breastfeeding specialist first, and then they come to me, or other way around, they come to me and then I send them, because my knowledge is depending on the baby, what the baby does, and the breastfeeding, so the IBCLC is actually focused on what the mother does. So
interesting.
So
but of course, it's a co-creation.
It's co-creation, exactly. Of course, we have to. We work together. I have my team that I really, really love. Yes, they know who they are, and we really closely work together. And we, like, after I finish the exam, after I finish the assessment with the baby, I call them. Okay, this. They're going to come to you. This happens. This is what I saw. Please help them with this and this. I don't. It's not my part of the job. So please, like this. Or other way around, they call me. Okay, I saw this and that, but I didn't give them exercise because you're the part with the baby and everything. So we have to work together to make the breastfeeding or the bottle feeding working properly, so the muscles of the face and the whole head are going to develop properly.
Okay. And what are, even not like going away from the baby to the first, let's say 10 years of life, even it might be focused on the first 6 years, but let's say until 10, what are typical things, may that be tension in the body, and if in the body, where, and or in the face, in the way of breathing that you see very commonly?
So most common is mouth breathing, the open oral resting posture, so the tongue is not suctioned to the palate, the tongue is down, the mouth is open. We have breathing issues, like maybe snoring. You can hear snoring even with the baby that is 1 day old.
Oh, wow.
Yeah. So, and of course, you know how snoring has a big implication on the further development of the brain and the breathing patterns and everything. Hypersalivating, so excess saliva in the mouth. Of course, that also has implications during when you get to the real food, when you introduce, I don't know, baby-led weaning or the purees or something. Even there, like that's the second step where you can see the issues.
Okay. What do you see then?
I see. Babies that don't chew properly, that hate to eat meat. They don't like harder structures and stuff like that. It's not that they don't like it; they just don't have enough muscle power to properly masticate and to do the proper movement. And of course, after that, we have. When you have open oral resting posture and breathing through your mouth for a longer period of time, and the kid goes to the kindergarten, what happens? They get infected. The respiratory infections are really, really, really common. Ear infections are really common with the babies that have OMDs, so the oral motor disorder. They're really common. A lot of allergies can be, let's say, prevented with a proper breathing pattern that they don't have. So snoring, sleep apneas, also they happen with small kids. Those are the things that I see mostly. Open bite, small and narrow palate that is underdeveloped, crooked teeth. So those are the, let's say, the most typical things that I see when some kid comes for an assessment, or even though adult.
Yeah.
For, if you say, from birth to 10 years. And of course, in all of that, you have speech sound disorder. Yeah, we have articulation that it's not really good. It's maybe like really like the crickets.
Exactly. But I mean, from my, I'm obviously no doctor, no medical person. I just, let's say, naively look from my perspective of practicing and being able to change the shape of my body, the change of my muscles, the strength, the mobility through my lifetime, through all the yoga I did, and through all the, essentially consistently focusing on what can I improve, what can I change, what is not working, where's pain, and what can I do about that. And so there's a lot of work that we can do. I mean, at any age, but
especially in the first years of life.
Yeah.
For example, especially for the breathing pattern, the head is really, for the babies in the first 12 months, it's squishy. Let's put it that way. It's really soft. The bone structures are soft. The upper fontanella, the small hole that babies have on their head, is still open. That means the head can really grow in a fast way. The palate is also not strictly like fixed. It's really soft, and you can change it really quickly if you but for the adults it takes a lot of time. But there's a book that I read recently, and there's a really good point in it. Actually, the muscles are the ones that are shaping the bone. Because especially on the head. Here, I mean, when you think about it, you have 8 muscles of the tongue. So tongue is not one muscle. You have like 12-ish muscles that are moving your lips. You have 4 muscles on each side that are moving the jaw up and down during chewing. And of course, speaking and breathing and everything. So you have really a lot of muscles doing their job. If they're doing it properly, the head will grow properly. The palate will expand in a way that it has to make room for teeth, to make room for breathing and everything. And if something is not developing in the right way, if the muscles are not engaged in the right way, then something in the bone structure is also going to change.
Yeah, exactly. And because the bones are growing so fastly and the muscles are not maybe exercised in the right way, that creates, of course, exponential problems along the way. And I mean, just with all the things that you were saying are the things that I also teach in my courses, that, as you breathe through your nose, you, with every breath, all the 10,000 breaths that you take each day or more, kids even more, you massage your sinuses, right? You're filling the sinuses. Nitric oxide gets produced, which is antibacterial, antifungal, opens the airways, right? When you place the tongue under your teeth, the broadness of the tongue is pushing against your teeth, which keeps them in shape. While if you mouth breathe, your whole palate grows narrow, which makes less space for the teeth, which makes crooked teeth.
Exactly.
When you chew properly, all those muscles are creating this broad, beautiful, aesthetically beautiful, strong jaw, which a lot of us don't have anymore. And, like you said, it makes perfect sense. When the kids don't suck properly, they don't have that base for them chewing. If they don't chew and mouth breathe, it stays even more narrow, and it just goes downhill from there.
Exactly.
And I mean, there's research. I mean, dentists talk about it, that they can look at a 6-year-old and can predict if they will need braces with 12.
Even before.
And even before, right? I mean, all these things, I guess, are getting earlier and earlier as we miss a lot of things in our.
I mean, it's
daily
I'd say
exposure.
codependent. There is one part of like evolvement evolving on a genetical level. That we are constantly changing. Our genetic material is constantly changing. We're not the same human being that, I don't know, 500 years ago. But it's also dependent on the style of our living right now.
Yeah.
Because let's take the feeding part. It's more convenient, it's faster to feed the baby the puree, it's cleaner.
Yeah.
And you don't have a whole lot of mess when you give the baby, as you have when you give the baby to feed themselves with food in its original shape.
Yeah.
And if you look at adults, if you look at us, I mean, the way of life is you have to be quick. You have to quickly do this. You work a lot. You run from this to one errand to another one. And okay, let's just grab a smoothie on the way. And it will fill me up, but you don't chew. What happens? You mostly engage your cheeks. You do this during, I know, and it's constantly something that you do. I don't know. You eat smoothie 3 times a day, 2 times a day, just to quickly get some nutrition in yourself.
Yeah.
And you don't engage the chewing muscles. You engage only the cheeks, and what happens? They push constantly to your teeth. And what happens then? It narrows the palate.
Yeah.
You push it because there's no chewing, there's no proper tongue movement all around your mouth, and you don't have the negative, like, let's say, push from the inside with the tongue on your palate. And what happens? The teeth just go like this.
Yeah.
They go inside. And then you need braces because your teeth are really tightly positioned.
Right.
And you have crooked teeth, maybe. I mean, I'm over exaggerating, but with the smoothie part, but you get what I mean. The food that we eat today is really processed. It's really soft. It doesn't need so much chewing as, I don't know, 500,000 years ago, when they were dependent on, they didn't cook it so well. Nothing was like mushy, and they didn't have a blender, and they have to chew.
Exactly.
And
which, I mean, and just changing, let's say, somebody hears it and says, okay, I will give some harder foods to my kid, that doesn't really solve it yet, because the whole process was around, okay, now it's 7 o'clock, it's getting dark, right? Now we sit around the campfire, and for 2 hours we can just sit there and chew. We will talk, and we will, have a nice social interaction, but we will just have time to chew because there's nothing else to do. Well, now you cannot be like, okay, let's quickly finish our dinner while at the same time saying eat slowly.
Eat slowly, contradictory.
So for the kids, it's not easy because they get these opposing ideas of, well, I have to finish my dinner quickly, but I should also eat a lot because otherwise, you have to eat more.
Yeah, so, but that's why, let's say, my part of work is actually, I call it prevention, because I try to teach parents to start them young with the solids. Start them young with the harder foods. And also, the whole theory behind it, it's much safer than the puree. Puree is quick. And it can go really quickly to your esophagus and like get you to gag reflex or, God forbid, the choking part. Then the solid food that the baby can sense in their mouth. They know where it is.
Right.
If you give like a hard piece of, I don't know, broccoli to the kid, they can sense it where it is in their mouth, and it prevents the gag reflex. It prevents the choking because bigger the throat is like this size for the kids, like really small.
Yeah.
And when you give them a bite of food that is this big, you cannot go through.
Right.
And it's much safer than the puree that it's just going to slide down.
Right. Makes sense. Yeah.
Yeah. So what I'm trying to do and teach the parents, what I do also in therapy, we early, about 6 months of age, introduce the solids in a form that how they're looking. So no mash, no purees, no blended like to soup consistency, but hard foods that the baby has to chew, so they have to engage the muscles in the right way. So we prevent the wrong oral resting posture, the mouth breathing, the whole other problems, the crooked teeth, the narrow palate, and all other things.
So it really sounds like loads of the problems that come after are kind of
we can prevent them
there.
Exactly. We can prevent them in the first year of the baby's life.
So most of your work is then like lifestyle coaching in the sense that you tell parents what to look out for?
Let's say, yeah.
Or is there some, because when you were saying you are checking out the muscles and the mobility and whatever, the tension patterns, I almost imagine, like a chiropractor then, releasing the tension.
No, I'm not the one that does that. Of course, I give the parents exercises, and the massages, how to relax this part of the body. But I always recommend some body work for the baby to relax the whole body itself.
Yeah.
Because it's codependent. One leg, I don't know, my left leg doesn't work on their own. It works with the whole body. It's connected to my hip is connected to my ribs are connected here, and other way around. So I have some people that are working closely with, that are body workers, and then let's recommend parents, okay, you have to do some body work just to release the tension in the whole body, so we can regain better muscle function. Even though, for example, the baby has some kind of oral restriction, it doesn't matter. We have to strengthen the muscle, because every tension, from yoga and everything, every tension is actually the sign of weak muscle.
Yeah.
So we have to work from all kind of stuff. I see the body as a holistic part. It's not only the mouth. I look at the body as a unit, because we have to look at it. Nothing works by itself.
Yeah.
So, and that's, let's say, for the first 12 months. Afterwards, for example, I don't know, from the first year, from first birthday to around 3.5 age, I mostly do feeding therapy. And during feeding, I give some exercises for parents to do, like a pre-feeding exercises to, again, engage the muscles, because you cannot make the 2-year-old sit down and say, okay, just do this and that. You have to go something that is more natural to them, more, as you already said in the beginning, more playful for them. And after 4-year mark, then the children are more cognitively able to perceive, okay, I have to do this exercise, I have to sit down and be here, for half an hour, I'm going to do this and this exercises, and it's going to help me, speak better, breathe better, sleep better, or etc.
Yeah.
So my therapy is really, for example, as you said, I am coaching the parents in the first year of life. But after that is more like therapy that I do one-on-one.
Yeah, but I guess it always has to go along. What I always tell people in, for example, yoga or in breathing, you can come to class once or twice a week, but some people even come more. But it's essentially, what do you do between the classes, right? And so I guess also in therapy, it's great to do something with those kids or babies, or tell parents, but then they have to actually do it in between the therapy sessions, and even and especially after that, right?
Yeah, I always say, I'm here to guide. You are here to do the work.
Yeah, exactly.
I know, let's say, I recommend stuff that are in the best interest of the child, but at the end of the day, it's your child. Exactly. I'm not with them 24/7. I see them, I don't know, once a month or maybe once a week for half an hour, 45 minutes. And I'm here to guide you to work, how to work at home, because you see them, you're with them 24/7.
Yeah. And I guess it also comes down to responsibility, right? So who's taking the responsibility, and who wants just something to be fixed?
Yeah,
right?
quick fix.
Just like with the bottle, it's like, well, I want bottle, so tell me which bottle, so the bottle fixes whatever.
Yeah, it masks. I don't want to mask and put a band-aid on the problem.
Exactly.
I want to solve the core of the problem and prevent all other problems that are eventually going to evolve at some age.
Yeah. What do you say works best in that scenario? Like explaining a lot, like let's say what will happen down the road. Like if you do this now, this is your beautiful future, and if you do not do anything, you might end up with, those 10 problems we just talked about?
Yeah.
Or is it more, other things that you...
Yeah, I think every one of my clients can confirm that I really talk a lot. Especially after the assessment, I tell them this is wrong, we have to fix this in this way, and it's going to impact this and this and this. And of course they all like tilt. I can see them like the wheels are turning in their head, but like really slowly and everything. And at the end of my session, I always say, okay, I know I talk a lot. I know I said a lot of new informations, but just take your time, like 1, 2, 3 days, then email me with all of your questions that emerged, and I will get back to you.
Yeah.
Because, I mean, if you don't see, especially, for example, a lot of parents notice the problems on themselves when they come with their children.
Okay.
And sometimes I say to the parents, okay, if we don't work on this, we'll get this. And unfortunately, we're going to get at one point to all of the problems that you, as your dad or mom, have.
Yeah.
And that's more or less like epiphany for them.
Yeah.
Wow. Okay. Then they get to the work.
Right.
I mean, as I work in a private practice, I don't work in a state
like you're not confined by insurance.
Yeah, exactly.
Yeah.
Some people that are willing to pay are actually willing to do the work.
Yeah.
Especially for the kids. I mean,
definitely.
you have a kid, you're going to do everything to make him like the baseline for afterwards.
Yeah, exactly. Yeah. So you have good like how do you say it? Like
good clients.
Good clients.
Yeah.
Clients that actually listen.
They actually listen and they work. I mean, I have to say, of course, this is a spectrum, as with you. When you, I mean, I'm the original, like, how do I say, primer, oh my God, example, of, I really did the work. I went through yoga school, I do the TT program, and afterwards, life happened. I gave birth to my first child, I gave birth to my second child, and life happens, and this one is sick, they have chicken pox, and I don't know, this and that. You just switch your, let's say, priorities from yourself to your kids, and you don't have time to work so much.
Yeah.
And that's also with clients that come to me. Some, like, textbook. Take everything that I said, they write it down, they film the exercises, they really do it like 4 times a day, as I said, for, I don't know, 15 reps every exercise, and really do the work. Some say, okay, we have an older child and it got sick, everybody got sick, we didn't do the exercises for, I don't know, 2 weeks, and it's okay. Yeah. It's normal.
Of course.
Of course. I always say, in a perfect situation, you're going to do the exercises, for example, 3 times a day. In a perfect situation.
Yeah, of course. Yeah.
I emphasize the perfect.
Yeah.
But I know that life happens. You have other things to do. You have to cook, you have to clean, you have, I don't know, gymnastics for the older kid, you have English lessons for the younger one, and stuff like that.
Yeah.
Of course, it's a normal thing. So of course it is. As more work that you put in, the better the results.
Yeah.
But it's okay.
Yeah.
Eventually, everybody does in the exercises in a way they can manage.
Yeah. Yeah, I mean, the way I always try to approach it, also in my own life with my kid, but also for myself, and also what I try to teach students, clients, is to kind of combine the things. So, for example, when we were talking about a small baby or a little older kid, like they are still preschool kids. If you, for example, take 20 minutes in the evening when you anyway take them to bed, and then you maybe massage them, or you take their arms and their legs and you kind of go through some body work, which can be a connecting thing. It can be a nice thing for therapy. It can be you talk about your day while you do it, or you just tell them about your day when they're still small, or whatever it might be, but you combine like 5-6 things all into one thing, so it's not okay, now it's time for exercise.
Yeah,
And we all get serious and this has to be done. But
yeah, exactly. That's
hey,
also that I'm saying to my clients. You, for example, for the babies, when you change their nappy, you can do the exercises.
Exactly.
It's here, the baby is there, you can talk, it's like you can sing, you can make up a song about the exercises that you're doing. I don't care.
Yeah.
Or for older kids, you brush their teeth in the morning and in the evening. You can incorporate, like, make it a routine to do the exercises in front of the mirror before you brush your teeth.
Exactly. Especially when you say, you know, the parents usually have the same issues, just, you know, 30 years more. Then it even makes sense to kind of playfully do it. Like, you know, all the, like, you know, in yoga we have, and I know you do similar things with the tongue out, like stretching and tongue on the upper palate and opening.
Yeah. Yeah.
Just to have a visual. And, you know, you can make funny faces and monster faces while you do it. Who can get the tongue until the tip of the nose or the cheek and stuff like that. So it can really be fun.
Sometimes I say to your parents, okay, just take a lollipop and guide their tongue to do what it has to do. It's going to be fun for them because they're getting a lollipop as a reward.
Yeah.
Or, I don't know, ice cream, something like that. Or you can put, I don't know, Nutella on a spoon and put it here just to get, like, the licking motion. And you do the exercise of tongue lateralization.
Right.
In a fun way with the kids. I mean, I do it in therapy also. I don't do it like, oh, okay, just open your mouth and do this. Yeah. No, okay, I put something just to tease them a little bit, to guide them, to make it more fun for them.
Yeah, exactly. Yeah, or, you know, when you jump on the trampoline and you shouldn't open your mouth, right? So you should breathe through your nose, or even some kind of little ways, and they have to take a sip of water and then they have to spit it out when they are done. So they can only breathe through the nose while they're doing the exercise. And stuff like that. So, you know, just make it fun, just
playful. Make more playful for them. Yeah. But just to get to the breathing point, the thing that you said, just put the water in your mouth and close it up and breathe through your nose. More or less for my kids, it doesn't work.
Okay.
For the kids in therapy, because if you have open mouth posture and you breathe through your mouth, your lip seal is really small. It's not strong enough.
Yeah.
So it's for example, it's a fun part you can do with any kid, just to engage their muscles around their lips. Just put the wooden spatula between their lips. They have to hold it. Yeah. Mouth is closed, and then breathe through your nose.
Exactly.
The small tips and tricks.
Yeah, exactly. And even then playing with, you know, in between your teeth and between your lips, because you want to keep it between your lips, so the lips closed, but not
the clenching.
The teeth. But on the other hand, it might be needed for the first couple of days to do it in between your teeth, so they even can grasp it at all.
Yeah, exactly. I say a little song that I like to say to parents. Unfortunately, I still don't have like a Croatian version of it. Okay. About the proper oral lasting posture. Tongue up, lips closed, teeth apart, breathe through your nose. Yeah. That's it.
I could totally say that.
Yeah, it sums up everything that you have to do to regain proper oral resting posture and the nice breathing pattern.
Yeah.
Yeah.
Great.
I still don't have the translation. That it sounds so cool, like in English.
No, but it's great.
Yeah.
So now we talked a lot about the mouth. Let's go a little deeper, like, you know, diaphragm, chest, spine, maybe even pelvic floor, belly muscles. Yeah. Do you see something there, and, you know, maybe with different ages?
Yeah, I mean, for example, it's a typical. What you see in adults, you can already see in young children from like 2 years of age. You can see the hunchback, the forward head posture. You can see the anterior or posterior pelvic tilt in their body, or some asymmetry in one way or another. You can see it all the way, I don't know, when they become toddlers. You can see it already there in their posture, how they sit. Do they sit like this? Do they sit like this? Do they maybe hold their head not straight but in a tilted way when they look at you? And that everything has, of course, some repercussions on the breathing pattern as you learn in your masterclass. And when I see that in children, of course, every exercise that I do with them, with the oral posture, with the oral muscles and everything, I always put them in the proper posture of the whole body, because you cannot take a deep breath if you
Exactly.
like this.
Right.
Yeah. So sometimes when I see the muscles are like really, really low tone, I recommend for parents to engage their kid in some kind of sports, some kind of physical therapy, or something, just to regain the muscle strength in the whole body, so they can sit properly and just concentrate on what the head is doing.
Yeah.
And for example, I have really a small, I mean, she's 7 years old. She's such a cute kid. And when I think about last year when we started therapy, she couldn't sit on the seat for more than 5 minutes. But she would still sit. You can see how hard was it for her. And after 5 minutes, she needed to take a break, because the muscles of the whole body, they were so weak. She couldn't sit straight. And now, after a year, she does like 45 minutes of therapy like this, without problem.
Amazing.
Yeah. You can see the progress, and it's really like, yes, we get to the point.
Yeah.
Okay, now we can really work on the breathing. Now we can really work on the closing the mouth and stuff like that. So it's like a building, like a Lego building. You have to start from the beginning, and then you go up to the roof.
Yeah, exactly. Because also the like if you have a bad posture and your mouth is open, now you're not using your diaphragm.
Okay.
And if you would close your mouth, and your nose is a little clogged, right? Because it's not being in use. So when you now close your mouth and you try to breathe through the nose, but your diaphragm doesn't have the pulling strength, now you're not getting enough air, and you're like, no, I have to breathe through the mouth, because otherwise I don't get enough air.
It's a full circle.
So, and one thing is actually you're really not getting enough air, but the other thing is the psychological thing, like
I have to
I have some kind of like fear response to not breathing enough. And that's also what I see with all essentially all my students, that like, why, I mean, everybody can hold their breath for 5 to 10 seconds, but why can't you exhale for 10 seconds? Because you don't know how to release the diaphragm slowly. So you have no control. And when you walk up the stairs, why do you get out of breath? Well, usually because you have a low allowance for carbon dioxide in your body, and when you start walking up, your muscles work more, there's more carbon dioxide that needs to be offloaded, and now you go into your pattern of offloading it through your mouth. But the other thing is, your diaphragm is not trained, doesn't get enough blood flow, and all of a sudden when you engage it in some way, like walking or even running, all the blood now tries to rush to the diaphragm, and your legs feel like, I don't have any strength.
That's our fight or flight response.
Yeah. And
when you're constantly in it because of the mouth breathing, so how do you, just to make it like baseline to explain a little bit, how do you engage your rest or digest part of the neurological system? Mostly by breathing through your nose and regaining proper oral resting posture. Because on the palate, you have the spot, our famous spot where the tongue is suctioned mostly, like the strongest suction is there. And at that point, a lot of cranial nerves are interconnected, and the biggest one is trigeminous nerve, that is in the order of regaining the sympathicus or the parasympathicus neurological system, so fight or flight or rest or digest. And if you breathe through your mouth, actually you don't have the stimulation of the trigeminal nerve, and your body is constantly in the fight or flight mode. So, and then you have the shallow breathing because carbon dioxide and everything that you explained. Now you have to make the body stay in that elevated state to make it work, actually, to survive.
Well, and then also, I mean, you explained that connection through all the cranial nerves are connected through your throat, through your palate, through your tongue. Through the diaphragm and the vagus, right? And so all those cranial nerves are misstimulated in a way, right? But then also because of the posture, and your eyes are connected to your tongue, and the tongue is connected to the throat and through all the neck and shoulders. And so, like, there's all these nice techniques and practice techniques where, for example, one is where you move your chin to the left and you gaze to the left, right? And you go all the way to the left. And that's already where most people are very restricted.
So hard for people to do.
So hard, right?
So hard.
Which makes sense, because if I'm in this position, I can also not move there.
Exactly.
But if I'm up here, and my neck is free, and now I can go there no problem. I can even go further and then even engage my opposite shoulder to create even a stronger stimulation. But now comes the next step where you go back and you still look to the left, and people are impossible. Like they cannot keep their eyes in one position that they are not moving. So there's a complete disconnect between what the eyes do, what the neck does, what the whole spine does, and absolutely no awareness how to control them separately. It's all one kind of bulk of joints that are not joints anymore, but one thing that kind of moves like somewhat together.
Everything. Yeah.
And if you then add to that all these cranial nerves, all the nervous system stimulation affects your heart rate, your heart rate variability, your blood pressure, the pressure that is in all parts of the body, and we can even go further where in the belly you have fascial connections and nervous system endings, where if you constantly squeeze your lower belly, you're constantly creating the connection to the brain. Hey, you are not in a safe place. If you can relax that, you could still have a stable core, but have the belly relaxed. And again, it's something that has developed maybe from a baby or even from embryo age on. And now you're 40 or 50 and you have all these problems and you're overwhelmed. So what to do, right? So what's a good, now we can maybe shortly talk about the adult age. What do you do now, maybe you as a parent that comes and notices, okay, I messed up in some way, and when I say messed up, I obviously don't mean it in a judgmental way, but rather in an encouraging way, like those are all muscles, they can all be trained in a different way, but I need to make some changes where I need to change something the 24 hours that I'm alive, not just the 1 hour a week where I go to some class. But what would, from your point of view, be a good step-by-step approach? And then maybe I can add mine.
Yeah. So before we started filming, I said, like in one sentence, you cannot make... I have to...
Yeah, please.
To play, so I don't make the quotation wrong.
Yeah.
If you want to breathe properly, you have to have a proper anatomical starting point. So if you are, 40, 50, 60, and you want to work on your breath, but your palate is narrow and it's high, that means you probably have some kind of deviated septum. So we have to see what we can, let's say, maximize our breathing with what we have at that point, but also while working on expanding the palate to make more room for the breath. So it's not a one-way street. I myself alone cannot help an adult person solve all of their problems with, wrong breath, wrong posture, with snoring, with sleep apneas or stuff like that. We have to have like a multidisciplinary team. I usually send adults first to go to a dentist that is actually airway centered. So we can see what kind of palate expansion work they can do. So we can regain, so we can get more space in the sinuses for the breath. And of course, parallel, we're going to work on what we have now, because palate expansion in adults it's not something that can be done in a month or two. It's a long process of, maybe a few years. So when we get to that point, okay, they do their assessment with the orthodontist. They say, okay, we're going to do, fixers of this and that kind, do a slow palate expansion that is going to take, I don't know, 6 months for the first phase, I don't know, maybe a year on the next phase, depending on how the bone structures are going to react. And then I know, and then they come back to me, and we're going to regain the muscle strength and try to set the proper oral resting posture. I'm always circling back to that because that's the starting point of everything. Try to engage the muscles in a proper way. So no, I don't know, so the tongue suction to the palate, that's, I don't know, the biggest and the most important exercises that they can do and everybody can do, because the natural, if you don't talk and if you don't eat or chew, your tongue has to be suctioned on the palate. That's the proper position. So that's the thing that we're going to do. We're going to engage the muscles to work with what we have. So when the palate is slowly expanding, we don't have such a big difference in muscle engagement that they have to do if we don't do therapy during the whole palate expansion part. So it's not one-way street. We have to go from all different kind of specialists. For example, also I send them to do an ENT for Croatia, is otorinolaryngolog. To ENT specialist. They do now mouth, throat, nose specialist.
Just to have a look.
Just to have a look to see, is there anything like deviated septum, maybe enlarged turbinates in the sinuses, enlarged adenoids or tonsils, that we have to work also on that part maybe, because sometimes the enlarged or swelled up turbinates in the nose, they come from allergy point of view, so they have to get some medical therapy for that to make the inflammation smaller, and to, again, if you have turbinates that are enlarged, of course there's even smaller space for taking a breath with your nose. And so it's multidisciplinary team. So it's not a one-way street. And of course I would send them to you because you're the breast specialist.
Well, thank you. It's an interesting thing. I mean, obviously, you and we talked about that even before we started recording, how as you're educated as a therapist, you immediately look at everything from, okay, well, there's specialists for everything. There's something wrong, and now what all the things we can fix, like nose, turbinates, palate,
body,
and so on. And now, there's like 5 different specialists for that, which is an interesting thing. And I'm all for specialists, like, if somebody has a muscle issue and I feel like they could benefit from going to a chiropractor or to some kind of body worker who can just,
click it back in place.
Get something. Well, I mean, every tension is there for a reason, right? So if we get that tension out, it will be back within a week or 2.
Of course, that's why.
So in that sense, I don't want to say like this fixes the things, because if that would be the case, then it would be easy. But rather, okay, let's take that out and see how you feel with that, and then at the same time change your moving pattern, train certain muscles so your body starts functioning differently, so there's no need for the tension to come back.
Sorry to interrupt,
no, please.
As I was saying with the babies, why do I always recommend body work? I give them exercises to strengthen the muscles and to relax the tension. But firstly, to relax the tension so we can engage the muscles in the right way.
Right.
And that's also what we have to do with the adults. I mean, you cannot engage the muscles in the right way while they're tensed. You have to remove the tension to be able to engage the muscles in the right way. So I know sometimes it's really overwhelming for people that come for assessment for me, because I say, okay, you have to go. I never say you have to go. I say, I recommend going to an ENT, do some body work, go to the orthodontist to see what we can do with the palate, with the teeth and everything. I recommend that because if we engage everybody, we're going to get the best possible result.
Right.
Because it's not a one-way street. You have to circle back. we have to look at the body in a holistic way.
Yeah, totally agree with that.
Yeah. So, but as you were saying, we come from different standpoints.
Yeah. Because
I see what is wrong and I have to fix it in a way with this and this and this and that. And you're working more or less to engage what we have to
well, essentially,
elevate it. Yeah.
What I wanted to say, I usually come from the perspective, or it's one of my teaching principles, or whatever you want to call what I do. I first have this idea that you can do everything.
Yeah.
Right? So you come to my class and I'm like, well, Monika can do anything. But then you can't.
Yeah.
And that's when I start asking questions. Right? So, for you, people come already with something wrong, a problem. And for me, it's often they come and they're like, okay, well, I want to do something. Of course, they have intentions. They want to feel better. They want to live more healthily, with more awareness. But I ask them, okay, this is what you want to do. So, for example, breathe through my nose, breathe through your nose. So, okay, you cannot breathe through your nose. And then we can start looking. Why can't you breathe through your nose? Okay, you have enlarged turbinates. Okay, so let's see, maybe let's add, some lemon salt water in the morning. So now I know you are hydrated. Right?
Yeah.
Simplest thing.
Yeah, simplest things, yeah.
Okay, and then, how long do you sleep? Do you eat? What do you eat? So because some people, they just eat lots of gluten and they stop eating the gluten and the nose all of a sudden goes away. The swelling goes away. Other people need something else. Right? Some people just have a lot of mucus, which might also be connected to the food that they are eating. So now I might additionally say, okay, so let's do some tongue exercises. Okay, you cannot do them, just keep playing with it. And let's maybe add a practice here and there that bridges that place to where you want to be able to do that thing. Right? But now you can also flush your nose with some saline solution, and maybe that helps already. If that helps, perfect. Keep doing it for a while, and then see if it also works.
Coming from the yoga point of view, I also say the nasal flushes, and that's like hygiene. Nasal hygiene is essential.
Yeah.
Essential,
especially in this world that we live in right now.
With all of the particles that are flying around, with the gases from the cars, and unfortunately we cannot live in a healthy environment all the time. But I always say, okay, we can also, I recommend, okay, start with that to see just to see, maybe it helps with your with the different, I don't know, if somebody has a deviated septum and their left part of the nose is blocked. Okay, let's see, maybe we can help with the rinsing, just to clear it out a little bit. It's not blocked completely.
Well, and also usually, because what oftentimes happens, from what I see, happens when people just go and they say, okay, so now I went to the specialist, I have a deviated septum, I need an operation or a surgery, right? Well, my approach is, you have a deviated septum, I acknowledge that, let's do the practices.
Work with that.
Like, not to fix the septum, but let's just to open the nostrils. And maybe through, flushing the nose every morning and doing some facial exercises and some tongue exercises, you might call them kriyas in yoga, but essentially they are similar to what you're doing.
Yeah, exactly.
Maybe you can breathe through your nose, and the diagnosis of the deviated septum doesn't matter.
Yeah.
Just like, you have 100 people that come in with the scoliosis, some don't even acknowledge it, some have pain that is not related to the scoliosis, but they assume it is. And some people are the most flexible people. They are like, excelling in all the practices, even though they have a scoliosis. Yeah. But if I would tell them, well, you have scoliosis, you shouldn't do that. Or I create a problem because of the diagnosis. Now, I'm not against diagnosis. Of course, that helps. But, just like with back pain, and then you look at the image, the MRT image of the spine, and you're like, oh, well, because of this, you have that pain, but it's actually not even related. Right? They did all this research. Yeah, I get what you're saying. So I'm not taking the diagnosis as something like, oh no, now, screw.
No.
But rather, so my approach is more, let's just do all the exercises, because then also what happens is, okay, they cannot let's say they cannot exhale, and now I'm telling them, just pause your breath. And they are like freaking out. So now, is it a physiological problem, or is it a mental problem, a psychological, emotional problem, or they feel, all kinds of emotions coming up? That is great. So now I can work with that and see what's behind that. It's not that the exercise was bad because it created the emotional uproar or the psychological instability, but it's rather great. We just needed to pause our breath for 10 seconds and you're already getting this effect. Let's dig deeper. And that's unfortunately where most people are like, well, a lot of people say, I don't know if I want to look there. But that's where we want to look, right? Otherwise, and that's, I guess, where a lot of this...
You have to dig deep inside
where
yourself.
a specialist might be like, well, I can fix your physical problem, but whatever comes up when that's fixed or when it's not fixed is something where you have to go to a different specialist. And that's, I guess, where also your approach is more holistic than just, okay, this is my specialty. I'm not looking anywhere else. And where also yoga or, approaches where you use yoga, breathing and so on help because
I send people to the specialists because it's important for me to know what can I work with. For example, if I send somebody to the ENT and they say, okay, you have deviated septum. And I said, okay, I can see that in your breathing pattern, but we're not going to run to do the operation of it, but we're going to work around that to maximize your breathing regarding doesn't matter that you have the deviated septum. And of course, if you, I will send them to the orthodontist to expand the palate just to gain more breathing space. Because it's important, but still I'm going to work on the breath itself regarding, it doesn't matter if they have a small and narrow palate. But I know that if they do the palate expansion, we can engage the muscles much more and we can actually, it's not cure, but in a lot of cases, we can eliminate completely the need for the CPAP because of somebody has a sleep apnea.
The CPAP is this mask.
Yes, the mask, CPAP during the night, just to keep the oxygen flowing.
Exactly.
So we can completely cure the sleep apnea, obstructive sleep apnea, if we expand the palate, engage the velopharynx, so the soft tissue that closes up where you swallow the so you don't aspirate in your nose. So we can get more engagement of that part, and the stronger the muscle, when you sleep on your back, it won't fall down. And the tongue won't fall down if we engage it and put it in the right position. And we actually solve the snoring and we eliminate the sleep apnea. In that way. That's why I need the different kind of specialist, but not to do some. I really try to avoid as much as possible those operations because it's invasive. We don't want that. We want to make people. It's maybe stupid to say, but I want to make people work for it.
Exactly.
Because there's no quick fix in my therapy. It's long therapy. It's not something that will be done in a month. It's something that you have to change the way of your thinking and the way that you're engaging your muscles, the way that you're breathing. You have to change your whole perspective on that.
And I mean, it's in my approach, it's similar in the sense that some people might be excited to do some movement, right? So like in Ashtanga yoga, you go from the movement because you like the movement, and then by moving, you notice, okay, maybe here I need to be more strong, here I need to be more mobile. I'm developing that. My breathing is not happening in the way I want, or certain movements cannot happen because my breathing is not there. Now I fix some breathing. And then, the meditation, the mental clarity, all of that happens as I go along. Other people come from breathing, and so, they might not be able to do the tongue thing or their throat is not open, but through the exercises, it becomes apparent that their shoulder is also closed. Now, adding some movement into that picture,
Yeah.
And then the third person might be like, oh yeah, I'm really into meditation. The breathing might help them a little bit with the meditation. And then from that comes again the movement. So whoever it is, you start with whatever they are excited about working on. And then the other things have to happen at some point and are added to that picture.
Yeah, exactly. For example, I have one adult that is going to come to therapy. We did an assessment and he said, okay, at this point, I really don't have time for the exercises because we're we're doing therapy with this kid, we're doing this with that. My wife is going back to work and we have to organize our life now completely differently because she's done with her maternity period and everything.
Yeah.
And I said, okay, but what can we do? We can start then with the palate expansion. Let's expand the palate. That is going to help with the breathing and make space. And afterwards, when you are ready, you're going to come to therapy to regain the belly muscle movement. Or from the other perspective, I have another patient, client, whatever you have to want to call it, that she's really excited for the exercises because it's fun. She says it's fun to do all other funny faces and everything, but she's at this moment not ready to put some pain in her palate and do the expansion, let's say that way. And then I'm not going to do that.
Yeah.
Okay, our starting point is, okay, let's do the exercises and maximize what we have now.
Yeah.
So I don't, there's no same pattern for everybody.
Yeah.
As you said, somebody comes for the meditation, somebody comes for the breath, somebody comes for the movement, but eventually it all twists and turns and got in this one blob of things at the same.
So I guess the combination of I want to take responsibility and do something here for myself or for my kid, obviously, and the excitement for working on something specific that is maybe even for our ego or for our external.
I can do that.
I can do that thing. Nice. So, which might be a nicer facial shape, or even or some physical thing that I can do standing on my hands or.
Exactly.
Might be.
I want to, as you said, I don't know. I want to change my facial features because I'm asymmetrical completely. Okay, we'll work on that. If that's something that if that is your goal at this moment, I'm fine with that.
Yeah.
But eventually, we're going to come to all of the other things that we have to do.
Yeah. Exactly.
Yeah.
Nice. Good. Do you have anything on your list? I know you had also a couple of things that you wanted to address.
I don't know. We went through all of the things. Yeah. We jumped from this to that. Change the palate, change the breath. That's what I had. The benefits of nasal breathing. We don't have to repeat that. I think it's something that everybody more or less knows.
Okay.
I don't know. Yeah, that's more or less that. Maybe just to circle back to the OMD, the orofacial myofunctional disorder, how maybe it can be seen with kids, except from the feeding problems that are emerging. Something that is common is the mouth breathing, but maybe a bad oral habit, like thumb sucking, biting on your lips, chewing some, I don't know, t-shirt that's commonly seen, for example, with kids. They have they have a plush toy that have to bring with them everywhere. And when they trying to fall asleep, they have to chew it. Something like that. That's a bad oral habit if it's continuously for, 3, 4, 5, 6 years. That's something that it shouldn't be there. Something like that. And those are the signs with kids that you can see prolonged pacifier use.
What would you consider, in terms of maybe daily use, but also in terms of age?
Okay.
What is too long? If there's such a thing.
There is. Let's say pacifiers are not bad in a way that in the first 3 months of baby's age. Especially if we're talking about babies with oral motor problems or preemies, so prematurely born babies, because the suckling of the pacifier, that's called non-nutritive suckling, is strengthening the muscles. So in those 3 months of life, it's okay to use it. Until the 6 months point mark, 6 months of age, it would be perfect to eliminate it just for, let's say, falling asleep, because prolonged non-nutritive sucking is actually preventing, it's a reflex that has to be gone, let's say, around third or fourth month of age. Because it's a reflex that has to let just be gone at one point. It's like the Moro reflex and Landau reflex. Those are the primitive reflexes that have to just be gone at one point of age. And if you keep the pacifier for longer than 6 months or 12 months, or I don't know, 3 or 5 years, I've seen kids with 5 years of age still with their pacifiers in their mouth, it actually slows down the proper development, because you continue to use the primitive reflex, and the brain cannot do the next step because this is constantly here, and you're engaging it and you're making it stronger and stronger, but it doesn't have no use. For example, after the 3 months of age, babies suckling and reflex sucking is actually turned into real sucking pattern. So they know sucking is for eating and drinking. Okay, and it changes the suckling response, the non-nutritive suckling. It changes from suckling to chewing, because in between 3 months and 6 months, we call it like oral preparatory phase for feeding, where babies have to strengthen then their chewing muscles to be able to eat solids at the sixth mark. Sixth month of age, like the mark. So if you use the pacifier still there, what is going to happen? When the baby puts the food in their mouth, they're going to suckle on it. They're not going to chew. So again, you have like slowed down process of learning how to chew and how to masticate the food. You slow it down because you have a pacifier that that the baby is still sucking. And of course, the change in the palate and the change in the open bite and everything. So everything after first year is prolonged pacifier use.
I mean, I was lucky with my son. I remember how at a certain point he was, I mean, he used it, I don't remember exactly the age. I think it was like 1 year and something, but there was a natural point where he just didn't want it anymore. Like where he was just throwing it away. Need it. And, but I mean, the way you explain it, like when falling asleep and stuff like that, that immediately brings up ideas like, well, if that's still happening, what else is maybe missing? What is it compensating for?
It's compensating for the palate to the suction to the palate, tongue suction to the palate, because that is what
the root cause of everything.
Exactly, root cause of everything.
Like what I always say, breathing is like the basic thing. Whatever you want to improve in life, you first want to fix the breathing.
Exactly.
And for you, it's essentially around your whole work. It's like you have to fix the palate and the tongue posture.
It's a tongue posture.
Everything else comes after that.
Yeah, I mean, as I always say, the breathing is the first thing that the body is going to protect. Let's say that way. Without breath, you cannot live. You can live without water for this period of time. You can live without food for this period. But without breathing, you cannot live for more than, I don't know, in extreme cases, the divers and everything for 15 minutes, but...
I think it's up to 26 minutes.
Yeah, I don't know. It's crazy. Yeah. But body is going to protect the breathing first.
Yeah.
And if you see that your kid needs the pacifier to fall asleep, if it needs the pacifier to regain calmness, to regulate their nervous system, then you have to like put a question mark. Why is that happening? Why my kid cannot be comforted only with my, I don't know, hug, my tap on the head, or why it cannot, I don't know, it falls down but it doesn't hurt, I don't know, the elbows, the knees. You can say, it's nothing, like, oh, look, the rabbit ran away or something. If you cannot shift their focus without the pacifier or the thumb, then something is happening here.
But what I usually see, and that, I mean, that applies to adults as well as to teenagers, I mean, any age really, is what is happening around it, right? Like if you tell me I don't sleep well, my question is, well, I might ask, are you breathing through your mouth?
Yeah.
But then, what is actually more important at that moment, what do you do the 5 hours before sleep? What do you do the first 2 hours after waking up? Do you do any movement throughout the day? What time do you go to bed? What do you are you watching your phone 2 hours before going to sleep?
What do you eat? When do you eat? Yeah.
And
before bed.
And the same with the baby. What is the baby doing the 3 hours before going to sleep? Is it watching some cartoons on a phone that is like every 5 seconds
flashing,
a switch in the flash, which I mean, just this topic. If I remember the movies that we watched, or sometimes when I show my son some movie from like 15, no, maybe let's say 20 years ago, that were still made with hands, where you have like a 20-second part of the movie where somebody's just walking across the screen and nothing else changes. And now there's not 5 seconds without really some drastic change in color and sound and everything.
Everything is loud, it's fast. And
exactly. So if you just take that, and it might seem like some people get triggered when you say, just check how many cartoons, and they're like, what, some cartoons? And but it's actually so simple if you just change some of those things, small things, and make the evening really a pre-sleep routine. And even routine. Some kids don't have a routine.
Yeah.
Like they have every day a different thing the 2 hours before going to bed. And now, of course, how is their body supposed to know?
No, it's
time
to relax and just to.
And then, of course, I can totally see how some compensational patterns, may that be sucking, may that be, whatever the eyes.
It's a quick fix.
Yeah.
It's a quick fix for the babies, because after the 12 months of age, they develop emotional connection to the pacifier, for example, because they know when I get that, it's quick fix. My neurological system is quickly calm because of that. Yeah. And of course, with big changes, with going to the kindergarten and everything, it's helpful. It's easier to put the pacifier baby in their mouth and make them calm in, 1 minute, than to listen to them cry and try to, comfort them for, 10 minutes.
Yeah. And it even creates this pattern, which then we see, even with the adults, of the pacifier as this external thing. I just want the external thing to fix that moment of discomfort, and then the adult saying the same thing. I have some pain, I don't feel well, I have anxiety, so what's the pill, what's the one little deep thing that
That's
I can buy?
The Band-Aid method.
And now I can do it, right? Versus what's actually behind it. And again, sometimes it's, and I know it from my kid, like usually when I'm upset about something because I want him to be, always great.
Yeah.
When he's not great, when he hits himself on the toe and now he's in pain, when he had some moment in school where somebody said something to him or, kicked him or he was not happy with how the teacher was treating him or whatever it might be, he's in discomfort and I don't want that. Exactly. So now I want to change that. I want to fix it. But no, I don't want to fix it because I want him to learn to feel the emotion and express his needs. And now I can coach him to a place where he can. And it's working great. Like, I mean, when he's like, oh, I cannot sleep. He's like, can you sit with me? And if I still cannot fall asleep. Okay, well, just watch your breathing, you know, put your hand on your belly, like you feel my weight of my hand on your hand, which is on your belly. Breathe into that, and now, you know, feel your toes, feel your heels. I mean, it's even a great anatomy session, right? Like,
of course.
okay, now I'm aware that there's my toes and my heels and so on. But you do that for 5 minutes and he's asleep.
He's done, yeah.
And now the next time he knows when I'm not falling asleep, I might just try that before calling my dad.
Yeah.
But of course, that needs that needs 500 steps before that, where I was there when he wanted to fall asleep and couldn't, where he was getting that trust in, you know, having his parents out by his side. All these little details of, you know, 500 days of his life.
You're falling down the rabbit hole.
Exactly, now we're falling down the rabbit hole. So it's...
But yeah.
So it's those small details.
Small details, but like on the bigger, let's say bigger picture, at the end of the day, the hardest job is actually the work on yourself.
Yeah, exactly. Because when I'm uncomfortable with myself because of my kid, I have to first deal with that myself.
Why is that making me uncomfortable?
Exactly. Yeah.
Why is that? For example, I mean, when I was a kid, I mean, in the 80s, 90s, what happened? A kid would, I don't know, maybe threw a tantrum because, I don't know, you didn't get like a lollipop in the store, and the parent, okay, just give it to him just to make him shush so nobody else sees that my baby cries.
Yes.
I'm okay with my kid throwing a tantrum because I'm setting a boundary that is healthy for him. Yeah. Okay, I know that you're in discomfort. I know that you want that, but because of this and this and this, I will explain and set a boundary there, but you cannot get it right now. Maybe you have, like, I don't know, 5 other chocolates at home.
Yeah.
You can eat them when we get home.
Yeah.
So
it's not instant gratification.
Exactly. So I'm okay with my kid throwing a tantrum in the middle of the main square. I'm fine with that. I don't care what other people think. Yeah. But that is something that we, as a parent, have to develop first, and not to okay, I'll give you anything just to shut up.
Exactly. Yeah.
It's hard. It's hard work.
It's totally hard. Yeah. And that's where all the practices, the yoga, the breathing, the taking care of yourself, being aware of yourself, being like happy with yourself, in love with yourself, all come in, right? Yeah. And if that's not there, then it's so much harder because the kid will just potentiate all these feelings. When I do some breath work and try to move the clavicular breathing to the abdominal breathing with kids, you have to make it fun for them. You have to make, I don't know, we blow bubbles, we blow whistles, we lie on the floor together with our, I don't know, plush toys on our bellies, so make them jump from the belly to engage the muscles, actually, to see where the breath has to go. Yeah. And it's work, it's hard work, it takes time, it's not something that will happen overnight. And the biggest part, for example, when parents ask me, okay, how long will therapy take? I don't know. It's a life.
I never know. It can take, I don't know, 3 months. Yeah. It can take 3 years.
Yeah.
I have no idea. Well, but it's work that the more work you put into it, the more you engage in all these exercises that I'm giving to you, the faster it will be done.
And it's really a lifelong process in the sense that there's always a new level of awareness and ability. And like, for example, and also for like this, it needs this frustration, like allowance for frustration, right? And not understanding, just like understanding that it's not immediately obvious. So, for example, I used to quite regularly get these like neck blocks where you cannot move your neck anymore. Yeah. And now by through many years of yoga and strengthening and becoming more aware of those movements, when it happens now, which is very rarely, but this summer it happened once because I was actually on a water park playing football on that salty surface and constantly falling.
Yeah, falling. Yeah.
And that somehow, I guess, locked something up. And then, for one day I was kind of doing the exercises that I know from yoga therapy that work. But I also have a very clear awareness of, okay, this is my shoulder blade moving, this is my arm moving, this is my neck moving. So, and each joint obviously going in at least 4 directions. So there's a lot of combinations possible, and I fixed it within a day. And then I was good again. And then my son had the same thing a couple of weeks later, and I was coaching him. And I just started off saying, you know, like move your shoulders up, forward, down, back, and back up. And already that was like not just like that happening. And you could say, well, you know, obviously you should be able to do that. But on the other hand, no. I mean, if you never thought of your shoulder blade as an entity, why would you be able to do it?
Yeah.
So I mean, obviously he could do it after a moment, like after one try, but it still took that moment. And of course with adults, it's the same thing. Like some people come to yoga and you like lift your hands up above your head and they're like, essentially an analphabetism about your body. Like you have no connection to most of your joints. And so when you start at that point, obviously it might take a couple of years until you're at a place where you can move your whole body, just being aware what the body could be able to do. And then it takes another 20 years until you manage to join.
You're aware that you know that you don't know.
Exactly. And so with the kids, they learn faster, but again, it takes some iterations.
Yeah, it takes some time.
But the thing is, if you're 20, ideally you do yoga, and within 30, by the time you're 30, you know what you're doing. Now you have a strong mobile body. You can age gracefully until 50, and then you can even pick it up a little more and really not run into any issues. But let's say you're already 50 or 55. Of course, your body has been cranking up a lot of issues through, let's say, not helpful movement patterns over 30 years. But, well, what's the alternative? Not starting and completely freezing up? No. And the same with the kid. Whatever their issue is, maybe they are in perfect health, maybe they have certain tongue, throat, movement patterns that are not ideal. Well, what is the best moment of starting? Today, even if it takes another 10 years. Well, that still gives them 50 years of living healthily or 100 years of living healthily versus start waiting another 10 years and now it gets worse. And then
it's worse and worse and worse.
Great. Nice. Well, I think we did it for today.
I think we did. We managed actually to squeeze the babies and the adults in the same one.
And so thank you so much for being here.
Thank you
for sharing all this wisdom and for helping with your work to improve those movement and speech patterns and everything essentially what we talked about. And thank you
very much for making this possible and to holding space for everything I had to say and for my ADHD brain that goes everywhere.
Well, you know, breathing helps with that as well.
I know. I'm working on that.
So thank you for listening. I hope you got a lot out of our talk and maybe some ideas what to do at home or where to get help from Monika, from me, from somebody like us. Have a beautiful day and thank you again for being here.
Thank you.